My name is Stephanie. I've been working with Dr. Kapoor for about 8 months now. The procedure I'm having done today is called Perma. It's actually a silicone implant that I'll be having implanted on both upper and lower lip. It is something I have thought about for a while. I've been wanting to get it done for quite some time. Actually, I wanted to get injectables. I never got it done. And then when this came out, I was really excited about it, and so I'm looking forward to getting it done. I have full lips, but I want a little bit of a plumpy look. That's pretty much the only reason why I want to get them done, just for a little bit more of a plumpy look for myself.
Basically, this is a very thin silicone implant that is contoured to the shape of one's lips.
It's been out for about a year now, and it is FDA approved.
They're different sizes, but what's nice about them is they look and feel very soft, hence very natural. It's permanent. Patients who typically get fillers have to do so every 6 months just to maintain some type of augmentation of their lip. Over the long haul, it does save them because it's a one-time cost and they're done. Much in the way when we do breast implants, patients have a variety of options, and it's really no different for the lips. There's typically kind of a small, a medium, and a large, and what's most important is they pick something that's going to match with their lips. Not exaggerated, but again, not too small so that you don't actually notice anything. Typically when they come in, we'll often size them. We'll actually take some measurements of their lips, get an idea of what they're looking to achieve, how much fullness they want, where they want it, and based on that, we can really customize an implant for them.
And if I do decide I don't want it anymore, they can actually take it out.
What's really nice about this procedure is that it's a very simple procedure to do. Minimal anesthesia, it's done under a local anesthetic. Often if patients are open to it, we'll often give them something in an IV form to help relax them a little bit. But honestly, it involves a couple of dental blocks in the lower lip and the upper lip and a little bit on the corners of the mouth. Once they're numb, they don't feel anything. I think the biggest thing that they ever talk about is they sometimes feel a little pulling and tugging, but really nothing painful or sharp. Typically what's done is a small incision is made at the corner of the mouth, and then a special instrument is actually placed underneath the skin of the lip and actually makes a little tunnel to go from one side to the other. And then the implant is basically soaked in an antibiotic solution and then passed from one corner to the other. And then once it's in place, which takes just a few minutes, it's basically molded into position just so it sits right. And it's the same for the upper and the lower. Quite honestly, it takes about 20 minutes to actually do, and again, what's nice is they're done. There's one little stitch on each side that will dissolve within a week. They can go back to a regular diet within a couple of days, and there's really not many restrictions. There's a little swelling that most patients do experience, but after a few days it's gone and they look really good.
I'm really happy with my results. Dr. Kapoor picked the perfect size. They're not too big, not too small. They fit my face just perfect. It's the natural look I was looking for. The procedure was under local. I didn't feel anything either, which is really good for me as well. After surgery, I was a little swollen right away, which is normal. You will get that. I didn't have much discomfort, nor did I have pain. I was really okay when I went home. It took a couple of days for the swelling to go down, and I had a little bruising, but not much. And I am an employee of Dr. Kapoor's. I decided to go with him, obviously, because I love his work. He does great work. He has actually done my lipo as well, and I love the work he's done with that. I would recommend anybody to him.